and I'm very delighted to be here. And I always believe if we have even 10 people in the room, but if they're the interested lot, I think that makes all the difference, rather than being in a crowd of 100 where 50 are not listening. So thank you for having me here, Mr. Raj. And yes, I love to introduce myself as being a captain's daughter because I feel so much pride in it. And I belong to a family of seafarers. So whenever there's an introduction rather than all what is said, I think what keeps me to this profession is being a part of a seafarer's family and an opportunity to work with these unsung heroes of our country and even globally, I feel. So, of course, this topic is very dear to me. I'm extremely close to this because I've been trying to work in this area for over 12 years now. And now gradually I'm seeing the change happening, so I'm very happy about it. So before me, Amri has already spoken about mental health, and she has spoken about many aspects relating to the human factor. My focus, of course, is going to be on mental health, but I want to share with you some information, some factual information as well, because I feel till we don't see data, we don't really, as human minds, we don't really understand the gravity of the situation and how it's affecting or impacting lives of seafarers, because once the seafarer is affected, their family also get affected. So let's start off with the presentation. Now, when we talk of mental health, she had asked you what is mental health. So I'm waiting for a day when we start talking about mental and physical health both as health, because they are actually both interrelated, interdependent on each other. And just as we talk about physical health, we must openly talk about this as well. So just to give you an example, so in COVID, every time a person coughed, we knew, oh my God, does he have COVID? And we have doctors for everything. So when I have a heart issue, I go to a cardiologist. When my bone is broken, I go to a orthopedic. I have a stomach digestive problem, I go to a gastro. Eye, ears problem, I go to an ENT. But if a person tells you, I have an appointment with a psychiatrist, I think I need to talk, we all look at the person as if, oh my God, really? And we don't say anything. But the minute the person walks off and we are like, oh my God, I think he has a mental problem. And I think the problem is with the word mental, because the minute we say mental, we feel the person is crazy, or the person is mad, or the person is not stable. And a very misconception people have is that when people come to counselors, they feel only when the person is having a mental health problem or an illness does he want to talk to a counselor. But that's not true. A person can just come to a counselor, I'm having a very bad day at work and I just want a very non-judgmental listening ear. I just want somebody to listen. And so the person can come to a counselor as well. It's not necessary that when the person goes through a state of depression, anxiety, only then the person would go to a counselor. So we need to break this. And in fact, we have had counselors, only thing we don't term them as counselors. When we used to go to school, our teachers, you see how much children share with the teachers, that much they don't share with their parents also. So we have had people in our lives, and when we used to stay, I've got an opportunity to be brought up in a joint family system. Got married also into a joint family. So when we are in a joint family, you have all our counselors in the family. So eventually this problem of, the child going through, somebody or the other is able to observe, talk, give them some life lessons and bring them back to track. Right? Now, why do I give this example? This is the same on ship. So when my father used to sail, he said, Deepti, we used to be 60 people on board, 50 people on board. And at that time, everybody knew each other, their families. No Wi-Fi was there, so no connecting back at home on regular basis. No air condition. He sailed on ships where there was no AC. Today, can we imagine sitting and doing this seminar without an AC? We start complaining. But these issues never cropped up because we had human-to-human interaction. We had that human touch. We had people to talk to. And today that has changed. From joint, we've come to nuclear. So we are dependent on social media, we are dependent on other factors which we can feel is the best way to vent out. But that is not how it should actually ideally be. Even if you see, a family going for dinner, you see 4 people sitting on a dinner table, the only time they talk to each other is what do you want to order? And after that, everybody is on their mobiles. Yeah? Yes? At home also, if you want to call somebody, where is he? Okay, just send him a WhatsApp, he'll come. Really? So you have to make an understanding of this whole thing. So when we talk of mental health, like I said, some interesting things which you also need to know is it's not a very uncommon thing in today's time. And 1 out of 4 people today globally are suffering from mental health. So like I said, 1 in 4 have a mental health problem, or when we talk about mental health issues which we are faced with. And like I said, it's all about how you feel about yourself and how much do you want to talk about it. 10 years back, if you asked me, nobody wanted to talk about it. They never believed that something like mental health even existed, right? And if it did, it is such a taboo, not only in our country, you'll be surprised to know, even in the Western countries, it's not taken off very well. But fine, thank God, things are changing now. Now, moving on, if you look into seafarers, we are talking about the marine, we are talking about their mental health and well-being. The suicide is the most common cause of deaths at sea, and this was submitted by the UK Chamber of Commerce. 15.3% deaths at sea were attributed to suicide. Now, when I talk about this, you also need to know that when somebody jumps off from the ship, whether you're going to declare it as missing or the person has committed suicide, it's very difficult to know. Because has the person slipped or has the person done it intentionally to kill himself? So those cases are still going unnoticed. And if we add those cases up also, then the rate of suicide will be way far more higher. Now when we talk about seafarers, and of course Amri has discussed that there are many factors why a person could go through a state of poor mental health. But before I move on, let me tell you, it is not only the seafarers who go through a state of poor mental health. Today, it is a global issue with everyone. I remember in COVID times where I was counseling people on the ship, I was also counseling people ashore. Because people ashore were also, especially the people in the manning department, were going through tremendous pressure, anxiety, because they were not able to figure out how the repatriation can take place, how we can bring our people back, how do we put in new people on ship. So they were also working 24/7. So it is both sides, only the environment is different. So when we talk about various studies which have been done, I've just picked up a few which are very interesting for you all to know as well. So the ITF Seafarers Trust and the Yale University had submitted one report in 2019. And there if you see, they had collected data and they found out that 25% of seafarers were prone to depression. Okay, their scores were showing that they were undergoing depression. 17% had generalized anxiety disorder. Now, 17% is a very big number. And in India today, if you look into our scenario, 24% of our Indian adolescents are going through anxiety disorders. So it is just escalating. 20% of seafarers also submitted by saying they had suicidal ideation. Now, when we talk about suicidal ideation, it means the thought of committing suicide coming to the mind of the person. So even if that is coming to your mind, it is a red alert. If I can think of it, I may do it also. I may not also, but it is a dangerous area to be in. So, among the depressed seafarers, the factors which were attributing highest or feeling down and depressed included, of course, isolation from family, supervisors' demands, and trouble sleeping. Now, yes, we do talk about COVID times, but let me tell you, mental health problem and issues are way back. Right? We have data right from 2013 onwards. So in 2013, if you check seafarers' suicide rates, it was 4.4%. Today, people say it was just 4.4%. But if you see, we have more than 1.5 billion seafarers who are working. So 4.4% for me is a very big number. Even in a company, if it's 1% of person, I think it's a big number. Every life is precious. And in a span of just 1 year, that is, I'm talking about 2015 and 16, it tripled. So what triggered that? And it tripled and it shot up to 15.3%. So you see the jump. Then, of course, if we move on to the years, 2017 came, 2018, and today when we talk about it, the rate has surpassed even 17.3% today. So you see, it is still escalating. There has to be a reason why this is happening. And you can't just say it's just happening. No, there has to be some trigger, some reason as to why this rate is not coming down. So a new global report from the International SOS Foundation and Affinity Health at Work as well, they submitted a very interesting study too. And that study was about that 1 in 5 are feeling suicidal all or most of the time. Now again, 1 in 5, that's a big number. 29% met the benchmark for clinical depression. 52% reported a decline in mood and their mental health suffered while on rotation. Seafarers are known as rotational workers, right? You have contract, you have your watch hours, so you keep shifting. And 46% experienced higher level of stress while they were on rotation. Right? And this is not a very old study, let me tell you. This was last year's, I think, study which was submitted. So, according to them, when we talk about remote rotational workers, 40% suicidal thoughts. So you see, again, this has increased. The earlier one which I showed you 2 years back, it was around 20%. It has doubled. And then we talk about loneliness, which is 37%, and emotional exhaustion. Now, why loneliness are we talking about? Oh yes, you're alone on ship. But if you look deeper into it, they say chronic loneliness is as dangerous as cigarette smoking. So it increases your chances of early death by nearly 14%. And this is all research, these are not my words. So that's the reason why when we talk about chronic loneliness, we have to really take it up very seriously. You cannot ignore that fact at all. GARD also does a lot of work on finding out about reasons, and they are doing a lot of work on well-being of seafarers and all. So they also came up that there are very generic factors which are inherent to this profession. What do you mean by that? That when I'm joining this profession, I know it comes with certain things which I cannot have much control over. And I think Amri has already showed, so I'm not going to put in too much time in this slide. But yes, one thing here I would like to point out is relationship issues. And coming in Wi-Fi, I'm not against it at all. Believe me, today we all need it. It's a boon, especially in COVID times. It helped you connect with family. But having said that, we cannot forget the not so good effect of Wi-Fi which has brought into the industry as well. So what has happened with it? Every smallest thing you come to know on a click of a button now. So your wife is having an issue at home with the mother-in-law, she'll message to your husband on ship and she'll say, I cannot bear this, your mother is this, we're having fights. What can he do? He can do nothing. But what have you done? You've caused him enough distraction on board. Right? Social media, of course, like she was saying, friends enjoying and you're feeling isolated on board. And then you try and relate your life with them. Over the past 2 years, I've come across 8 cases of cadet suicides. Indian cadets I'm talking. 8. Again, huge number. 8. And most of them attributed to relationship issues. So they can't deal with breakups. They can't deal with rejection. Do I blame them? No. I blame ourselves. I blame the way we are nurturing and bringing them up, because they are in a race where we want them to win. We want them to do the best. You have to perform the best. So you are trying to strike in them, and we all have children here, that no, you have to do your best. You have to score well. But none of us are training them for failure, for rejection. There will be a chance where you will fail. So how will you handle it? There will be a chance you'll be rejected at a job by a girl. So what are you going to do? So we are not teaching them how to deal with failures and rejections. There are so many models. We talk about resilience. What is resilience? Do you think I'm not resilient? Do you think people who are resilient don't have their breakdowns? Of course they do. But when I learn how to cope with it, I learn how to come back to it to a normal sense, little faster than the people who are not so resilient. But the fact is that we are not teaching the millennials today who are there. Definitely their tolerance, their patience, their ability to endure emotional disturbances is much lower. And so, are we teaching them that? No. You ask any person in school, are you taught emotional hygiene? First they will look at you. I asked a teacher, because I do counseling work for one of an international school. So I asked the teachers, are you all taking some module on emotional hygiene? So they all looked at me. What is emotional hygiene? So you don't even know. At pre-C institutes, they are taught how to be rough and tough. But they're not teaching that there will be, so when they go on the ship, they have a full 180-degree turn. And they feel, oh my God, where have I landed up here? What am I doing? This is not what I had expected. So these things are not addressed at all. And that's the reason why they go through what they go through. So we are not teaching them that. So somewhere I think we are responsible for what is happening out at sea as well. And I think it's very important that we should take onus for this also. We have to take it. Yes, we are failing somewhere. Otherwise, these rates can just not go rising like that, right? So when we talk about mental health, like I said, we need to understand that just by testing a person, whether the person is mentally healthy or not, and then sending him to ship, is that enough? Right? If you ask me, I said no, that is not enough. Right? So when we talk about paving ways or moving ahead, what can we do? I always feel there has to be a more proactive approach to anything rather than a reactive approach. And this industry, I don't know, I feel has been very reactive. If something happens, then they want to do it, right? A suicide has happened, come on, let's do a seminar on mental health. It doesn't work that way, right? So it has to be more, like I said, more proactive. Now for me, if you ask me, we need to start firstly by cultivating it as a part, like how we have food, we breathe, we exercise as a part of our lifestyle. This has to be incorporated as our daily regime, what we do. Until that doesn't happen, people will not take it without thinking it is, oh my God, mental health, It should be, oh really, mental health? Wow, let's do it. It should be that way, right? So to start, the focus of mental health training is, like I said, very reactive in nature. That needs to change. So we need to understand that we have to center things around that how is it when the person is feeling in a certain way. Now, when we talk about signs of anxiety or depression, or a person is going through chronic stress, how are you going to deal with that person? Are you good enough? Now, again, honestly, if you ask me, you don't need to have great degrees and certifications to counsel someone. If you're a good human and if you are empathetic towards the other person, You can connect with the pain of the person, you can do great at helping the person. Right? So, effective training in mental health awareness for seafarers and both shore-based staff as well, that is what needs to come about little more. But I think I'm fortunate that with certain companies, they have started with this proactive approach where they are not only taking shore staff into training, they're also incorporating seafarers at all levels in order to bring them to a same page so they both understand each other's problems. It's not that people in office don't face problems, they do. Grass is always greener on the other side. And people on ship also face the same. So you need to understand how to strike that balance. So they need to be more engaging towards it. And finally, of course, we are talking about well-being and wellness. So wellness, if we look into it, it's again a very broad concept when we talk of it. You cannot just say, if I ask you a simple question, are you well today? And you say, I'm perfectly fine and fit and fine. So most of the times when the person is saying I'm well, the person is talking about his physical wellness and not mental. Right? But again, we have to understand that when we talk of well-being and wellness, it is about, you're not just there for living, you have to thrive when you're living. It's not surviving, but it is actually thriving. So we have different ways in which you can stay mentally healthy on board as well. And there are some aspects of which we incorporate in our lives. I think we will be able to have a much more better approach in handling well-being on board. So when we talk about well-being, first of all, what is well-being? When I say I'm in a good state of well-being, firstly, it means, like you all mentioned, it's being happy in whatever you do, right? So you are feeling a sense of happiness and contentment. Working more productively, where you're putting in your maximum effort, you're effective as a worker, as a professional. Making a contribution to community, I think it's very important. There has to be time where you have to give back also. Right? Of course, it's very important to grow professionally, to do things for yourself. It's important for our motivation. But at the same time, you should be able to give back something to the people because of which you are there where you are. Right? Then realizing own achievements and abilities, appreciation is extremely important. And if somebody says, I don't need appreciation, I do it because I want to do it, I don't believe in that. Everybody needs appreciation because that is a booster for us as well. And then coping with the normal stresses of life. No life today is without stress. Even a traffic can stress us out. Yeah? So there's nothing without stress, but you need to know that there has to be some coping mechanisms which you need to have in order to deal with the stress. Correct? Either you can really stress yourself out and then you get stuck, or you decide, okay, this is there, let's look into it, what can we do about it? And I always give this example because my husband hates the traffic in Mumbai because he's raised outside India. So whenever we shifted here, he said the traffic kills me. And he gets very irritated. So when he comes here, he tells me, we are going out, you have to drive. So I always tell him, see, you can't do anything about the traffic here. Can you? So you put on music, either you listen to music and relax and we'll reach when we have to, or you keep cribbing, affect your mind also and mess up my mind also. Its choice is yours. You can choose to do what you want to do, right? Same way we have to choose things which we can control and things which we can't control. Things which we can't control, there is no point wasting time talking about it as well. So lastly, I leave you with 5, it's an acronym which says give calm. Very simple, but very effective. I also practice it myself, otherwise I would not be saying it here. So when we say give calm, it's an acronym like I said. The first one is, I always say joy of giving. Now, what do you give? Sometimes people says, I'm very generous. So yesterday actually I was at a conference, MSI conference, where they had told me to come and take a workshop with them for 3 hours on mindfulness. And there's one aspect, 9 attitudes, one of them was generosity. So what do you give? So I asked them, what do you give? Oh, I give donation. I give this, I give that, I give this. I said, the one thing which if you ask me today, what you can give a person, what do you think that is? Time. Fantastic. Time. That is what we are not giving. And that has become the most scarce resource today. So how much of us we know how to give? So giving, not only time, I think what you can give to a person is your experience, your knowledge, your positive vibes to make that person feel better. So giving is very important, and they say when you give, it promotes happiness. So when you're giving, you're committing an act of kindness. And like I said, some people tell me, how can you do act of kindness every day? I said, why not? How difficult is it? I said, you're driving, somebody wants to cross the road, nobody is stopping. You stop. Let the person go. That's an act of kindness. Simple. They say, how can that be being kind? I said, of course it's being kind. You're allowing the other person what the person wants. So that is an act of kindness. Everything cannot be materialistic, right? And of course, time and attention. Ask ourselves, we are working professionals, how much time today, even when we have to spend time with our parents, we need to plan. We actually need to plan, when can I go, which day can I go, and how much time, 1 hour, 2 hour, will it be enough? It's so sad that, we have to find time for things and for people who are most closest to us. Second is to connect. Now connect here, I'm not talking about connecting virtually to people. Connecting with, when you're on board, connecting with people on board. It's very essential, I feel, because if anything happens to you there, they will be the first people who will come up to you. Now, speak to someone. It's very essential. We are humans. We are still not robots where we don't need people around us. I can't imagine a date not talking, to someone. I have to talk. I'm a very talkative person in general, but I cannot not talk, I have to talk. So you need to talk to someone, and I can talk to anybody. Even if I'm going in a rickshaw or wherever, I can talk to, my whole journey we both talk, So you need to understand that when we talk and when you hear other people talk, it just eases out and your mind is not occupied with anything else at that time. So you need to speak to someone, try and connect with someone. And I just don't like too much of, when we do WhatsApp and people send emojis, yeah? So your wife is at home and you get up in the morning, you see your cell phone on ship and you send a heart. The wife will be very happy, wow, he sent me a heart. But you don't know that he just sent it because you keep quiet at home. Don't ask me what I'm doing. They don't have feelings, do they? You're just sending an emoji. But it's important that you connect with where emotions are involved. So you need to connect, give your time to someone. It's very important. Please give time to anybody, even on ship. Sit and talk to the chief cook. Chief cook is one person, poor thing, he never gets a shore leave, yeah? Because he has to cook, yeah? So sit and talk to him, sit and talk to ABs and anybody, irrespective of rank. Then be active. Yes, of course, I know when you're working on ship, it's a high intensive job. And like she was saying, yeah, you work so much on board. And then they say, ma'am, humne itna kaam kar liya that abhi we don't need to do exercise. I said, no, there's a difference. When you're working, you're working. When you're exercising, it is more consciously you're focusing on something for your body. When we work, we are not focusing on our body, we are focusing on work. So there are two different things. Like how my mother-in-law tells, I always tell, I complain to her, you never go down for a walk. We have a beautiful joggers park, why don't you go? I walk so much in the house when I'm working. I said, that is not exercise. You're doing something which subconsciously, you're just doing it. But when you're doing a conscious effort, then that's called being active. Now being active, I'm not saying you need to pick up weights. I also don't do that. Okay, or go to the gym and high intensive. No. Just a walk or pick up any sport which you like to do. You like to play an instrument, do that. It's anything, something which makes you active. Then take notice, which again we don't do. That is being mindful, Do you take notice of what is happening around you? Are you curious about why certain things happen around you? How many of us are curious even now to think of when we see things around? I think we've lost that touch. We don't question, we don't challenge, we don't notice any change because we are so much full of ourselves. So you need to pay more attention to what is happening around you, right? So you have to notice, how many of us notice when the rain comes, what happens to the trees outside? What is happening to the environment which has suddenly changed? When you're on ship, at night especially, it's so beautiful. Those who have sailed, all of you must have sailed. I have also sailed. I used to love the sight of the moon and the stars at night. It's so beautiful. What do you notice? So that's about environment. But do you notice people also or not? If somebody is sad, are you able to notice the person is sad? Are you able to notice that somebody is not looking okay today? We don't notice. Do you notice weight change in a person? On ship, suddenly the person's weight has dropped. Doesn't that bother you? Why this person has lost weight? We don't notice. But we need to notice, it's very essential. And then, of course, keep learning. If you are a lifelong learner, if you love to learn, your mind, and this research says the more you learn, the more active your brain will be. And the more active your brain will be, the more you'll be in a position to take up challenges in your life, and you'll be a fresh person. You're young. Age is a number. I always see, my father tells me this. Age is a number. It depends on you how much you want to go ahead. So continued learning through life enhances self-esteem, and it encourages social interaction as well. Because when you want to learn, every conference you go to, every time you interact with people, you meet new people. You learn from them. But today if I say I know everything, then I become stagnant. And then your downfall is going to start. You can learn from anybody. You can learn from your children to anyone on top. Any person, you can learn. And you should not stop learning. All right? So the practice of setting goals for yourself, which is related to adult learning in particular, has been very strongly associated with high levels of well-being. And this I say it with experience. Not that I'm old. My dad is old. He's 75. But if I use the word old, he looks at me, what are you saying? And if you ever ask him, are you tired? I'm not tired. I'm like, okay. He's like, are you tired? He questions me in turn. Are you tired? I said, no, I'm not. But the fact is that at 75 also, if you ask him, do you have a goal in life now? He's saying, of course I have a goal in life. So if you ask him now, he's into share markets, he'll tell you what his goal there is. Every day he has a different goal only. And I think that's the reason why he's so active. And he's in a happy space, very content man. So it's very essential we understand that when we talk about mental health, well-being, we need to be more proactive. We need to respond. And the last thing which I would like to end here with is, and this I believe in myself, which I think we all must try and understand, that, when we talk of mindfulness, there's a statement that between a stimulus and a response, you have some space. And that space will give you power to change what you want for yourself. So if a stimulus, that means if something happens, and if I just without thinking I'm going to say something, that means I've wasted that space. I've made a wrong decision or a choice. But if you think back, step back, think what you want to do at that moment, and put your own well-being in your hands. You are the person, your best treatment for yourself is ourselves. But we need to take it. Yes, we need help from professionals. They will guide you. But whether you want to do it or not is in your hands. So that willingness should come. Right?